All right, everyone. Thanks for calling or logging in. Again, this is Teresa Ramos with Illinois Action for Children, and we're thrilled to be going over our most recent report. We're going to do a quick whip around this room to tell you who's here. Then we're going to go into the presentation, and then feel free to type your questions and our chats in throughout the presentation, which we will get to all the questions at the end, if not before. I'm going to kick it over to David to introduce himself.
I'm David Alexander, the Research Director at Illinois Action for Children. I'll be doing most of the talking today.
This is Marcia Stoll, Assistant Director of Research. Lorena Lara, Research Analyst.
Lillian Matsuda, Policy Associate.
Liz Wilson, Project Manager. And we'll also have Maria Eslin joining us. She is our Senior Policy Associate.
Great. All right, so let's get started. David.
Okay, great. Thank you very much for attending. Hopefully this will be very interesting. It was interesting for us to do this research. You know, there's been a lot of interest lately in the impact of the QRIS system, the Quality Rating and Improvement system in Illinois, Accelerate Illinois, and that's what we're going to be talking about today. This research was done in 2017 and 18 based upon data up through 2016, so it's not the most recent. But I think there's enough in the results to give us pause for reflection. Next page. First, I'd like to acknowledge the funder, which was the Administration for Children and Families. The research was conducted under a research partnership, the Illinois-New York Child Care Research Partnership. Julie Henley was the principal investigator, and Heather Sandstrom and Amy Cleasons were the co-principal investigators. We'd like to thank the Illinois Department of Human Services, the Bureau of Child Care and Development, for assisting us and giving us permission to look at a lot of the data, and the Illinois Network, INCRA, the Illinois Network for Child Care Resource and Referral Agencies, which also supplied a lot of the data. And then since we worked with two SDAs in Illinois, these two SDAs, 6 and 14, we appreciate the directors and the staff's contribution to this research. And there are a large number of other people, individuals, whom we should be thanking but don't have time to do. Thank you. First, the study overview. The study period is 2011 to 2016. We were interested in changes in the supply of quality child care for low-income children in Illinois, but in these two study sites in particular. One study site was Cook County. The other was what we call southwestern Illinois, but many of you know as SDA 14, which is composed of 7 counties, which are listed there on the slide: Madison, Monroe, St. Clair, Randolph, Washington, Bond, and Clinton counties. The research focused on 3 research questions. One, all of them having to do with access to child care for low-income children. And by low-income children, we mean subsidy-eligible children or CCAP-eligible children. Did that access to quality care increase, first, for all children, birth through 5, secondly, for infants, and third, for children whose parents need care during non-standard hours? Oh, by the way, access for us means a number of things. Access refers to the number of slots available for families, but sometimes we'll look at also the location. Is the location of the new child care slots, is that an accessible location? And third, the access can mean affordability. Are the slots affordable to the families with low incomes? We have the following definition for our study of quality. We're all interested in quality care. We took a kind of a formal approach. Since we didn't want to tell you what quality care is, we wanted to use the definitions that other people supply. In 2011, a provider provided quality care if they participated in the old quality rating system, the old QRS system. In 2016, they provided quality care, in our definition, if they participated in the new system, Accelerate, at the level above licensed. So more than licensed, either bronze, silver, or gold circles of quality. Then in 2011 and in 2016, we would also accept 4 national accreditations as definitions of quality or as indicators of quality, and they're listed on the slide. Also, then finally, we are interested in quality designated care for providers who either accept the child care subsidy, CCAP, Child Care Assistance Program, or are willing to accept children who participate in the Child Care Assistance Program. That's our low-income focus. The policy we want to talk first about the policy context for looking at improved access to quality care in Illinois. There's one slide here on what's partially favorable about the policy context, and then a slide about what's partially unfavorable about the context. First, in 2012, Illinois received a federal Race to the Top Early Learning Challenge grant to develop a more comprehensive QRIS system, which was rolled out in 2013 as Accelerate Illinois. Many of you know, but perhaps I should go over some of the details of this just for a minute. All licensed programs were enrolled in Accelerate Illinois, and then extensive outreach was done, and training and technical assistance done to increase the number of providers who are interested in getting a bronze, silver, or gold circle of quality. Programs that did participate at the gold or silver level were given a 10 or 15% add-on to their child care assistance reimbursement rate. Finally, professional development funds and quality improvement funds were aligned with the quality improvement process. So in a nutshell, that's what QRIS in Illinois began as. The second favorable policy context is that in 2014, a number of Illinois communities received federal early Head Start and Child Care Partnership grants, which allowed providers to combine child care and early learning funding to provide higher quality child care. And this likely stimulated the supply of quality care for children up to age 3.
There's a question about what type of child care. Is it home-based, licensed center?
Good. Well, I'll say this as we go along, but we looked at both licensed homes and licensed center care. So in some of these analyses, they're combined, and in some of these analyses, they're separated. We did not look at family, friend, and neighbor care, the license-exempt sector. And we looked only at the administrative data that was available from IDHS or from INCRA, and census data. The less favorable policy or context, it's not so much policy context, the first is economic. After the very, very deep 2008 recession, the Illinois economy, like the national economy, emerged very slowly, but the Illinois economy emerged much more slowly from that recession than did the national economy. Growth in jobs and family incomes was slow, but it was steady in Cook County. It's much slower than the national average. But in southwestern Illinois, in the 7 counties of southwestern Illinois, the growth was much more limited. And in fact, the population and overall employment fell in southwestern Illinois from 2011 to 2016. That's what economists would say, call a distressed economy. And median income, some of them grew very, very rapidly. There was an 11.9% increase in Clinton County, but there was a decrease in St. Clair County in family incomes, which is, again, a sign of distress. Secondly, providers, as many of in the audience will remember, experienced a lot of distress or instability on their own part. The state budget crisis affected provider payments, and even though many weren't technically late, providers experienced those payments as late. It rocks their confidence quite a bit. Then in July 2015, the governor enacted emergency rule, which severely restricted eligibility for the Child Care Assistance Program from 185% of the of the federal poverty line level to 50% of the federal poverty level. And enrollment and income declined sharply for providers. And you have to think that providers who are losing enrollment and losing incomes in 2015 are, even if they've already started the process of improving the quality of their slots or increasing the number of quality slots they have, they're not likely to continue, or many of them will think twice before continuing in making those investments with such low incomes. Okay. And then the third part of this is that the center reimbursement rates did not increase at all after 2012. And scheduled home rates did not increase after 2015. Excuse me. Now we're getting to the findings. First, I'll show the good news. Some of the key findings in our reports. There's much more detail in the reports, much more analysis if you're interested in looking at that detail. But here are a number of the pieces of good news, and then we'll turn to the somewhat less good news, that finding. First, the supply of quality child care slots for children birth through 5 increased substantially in both regions. On the left, you can see Cook County, 2011 and 2016 in the gold. The number, again, these are just the increase in quality slots. This is not the total slots in Cook County, just the increase in the quality slots for children of this age. There was an increase of 11,000, or 63% increase. In southwestern Illinois, which has many fewer slots to begin with, there was an even larger percentage increase in the slots from 1,681 to almost 5,000. So these are what we regard as significant increases and good news for policy, or the impacts of policy. Look next at infant slots. There were even more significant gains in quality designated infant slots in Cook County and southwestern Illinois. You can see there's a 93% increase in Cook County, an increase of 1,479 slots, and in southwestern Illinois, an increase of 440 slots, or 239%. Again, very substantial increases in just 5 years after the introduction, or between the year before and 3 years after the introduction of the QRIS, Accelerate Illinois. Okay. Next, this is a little more complicated slide, so I'll dwell on it a bit. We were interested in doing some community analysis or geographical analysis. We were wondering, access is not simply a matter of more slots, but having more slots where the children who need them live. And that's what this analysis is about. We divided all communities, which is where we use census tracts to measure communities. We divided all census tracts into those with above average concentrations or percentages of children eligible for CCAP, and those below average concentrations or percentages of children eligible for CCAP. And we looked at where the new quality slots went. You can see here, 59%, the larger share of them, went to communities with high concentrations of children who are eligible for the Child Care Assistance Program, low-income children. 41% went to other communities. Okay. This is not to say that there aren't children eligible for child care assistance in that 41% with those slots. But this is a good indication that the slots went where children needed them. And it's also a bit of an indication that policy worked. And you can think of it in this sense. The Accelerate policy increased the add-ons for children who had CCAP. So providers who have many more children with child care assistance are more if they're responsive to policy changes with add-ons, they will increase their slots, and that seems to be what happened in this case. If you have any questions about this slide, please ask. Here's another geographical analysis. Again, is the location convenient? Is the location of new slots convenient to families? This we did just in Cook County because we used addresses of actual child care assistance cases, and we had permission only in Cook County to do this, not in southwestern Illinois. We looked at the 2011 addresses of every family with a child care assistance in Cook County. Then we measured the distance from that address to their nearest quality child care address. We also measured the distance to the nearest non-quality address as well, or child care address. Okay. We did that in 2011, and then we took that same address in 2016 and measured that distance. You can see here that over the 5 years that we're looking at, the average distance from the CCAP family to its nearest quality center, I'm sorry, this is the quality center case, was 0.9 miles. It fell almost by a third to 0.6 miles, suggesting then that by location, by this indicator, quality slots are more convenient, more accessible to low-income families eligible for child care assistance. No questions in the room? Those are some of the key findings. You'll have more. There are more positive key findings in the various reports that we're producing or we're publishing now. But I want to turn to some less good news, some of the key findings that call for more reflection about policy. First, this is the flip side of the Cook County. If you were wondering when we showed the pie chart about the communities in Cook County, communities with the higher than average percentages of CCAP eligible children and lower than average percentages of CCAP eligible children, what was the state in southwestern Illinois? Well, just as it was positive news in Cook County, it's less positive news in southwestern Illinois. Only about a third of the new quality slots went to communities where there were high concentrations of low-income or CCAP-eligible children. Okay. Oh, by the way, it appears that, again, that there may be economic reasons for that, to the extent that providers are in economic or financial distress. Were they likely to respond to the incentives that the Accelerate Illinois provided to them? Well, in Cook County, with a more stable economy, more jobs, more parents needing child care, providers seem to be more responsive to the incentives of Accelerated Illinois, while in southwestern Illinois, providers under somewhat more distress, declining jobs, and declining population seem less inclined to respond to the incentives offered by Accelerated Illinois. The next slide. Despite substantial increases in the supply of quality slots, what are they doing the job for children in southwestern Illinois and in Cook County? For this analysis, we used the concept of a coverage rate, where we looked at all of the eligible children in Cook County and all of the eligible children in southwestern Illinois, and then we just asked what percentage of the quality rated slots, the quality designated slots in those regions, what percentage of the children are covered by those slots. You can see in Cook County, the gold parts of the bars in 2011, 17% of the eligible children were covered by the slots. In 2016, 27% of the children were covered by the slots. That's a large increase, but by the measure of all the children who were eligible for child care assistance, the supply of quality slots remains very low. And in southwestern Illinois, it's, again, the same thing is happening. While there are substantial increases, the coverage rate remained very small, very low. Access is also affordability. If there's a child care slot next door to me, but I can't afford it, I don't have access to it. So how affordable are the new slots? In this picture here, we take all the slots, not just the new slots, but all the slots for infants in Cook County in southwestern Illinois, and first identify which ones were not quality designated, and this is just in 2016, this is at the end of the process. You can see that more than half, in Cook County, more than half the slots were not quality designated by the end of the period of time, and somewhat less than half were not in southwestern Illinois were not quality designated. So southwestern Illinois is clearly doing better. Of the slots that were quality designated, that's the gold bar and the light purple bar. Only the gold bars are affordable. So you can say in Cook County, of the quality designated slots for infants, these are in centers, by the way, just the center base. For infants, fewer than half of them, almost as low as 1/3, are affordable. While southwestern Illinois, the situation is much more favorable. The vast majority of the quality slots for infants are affordable. And by affordable here, we mean can be paid for by the child care assistance reimbursement, plus the add-on for quality. A fourth bit of bad news, or at least less favorable news, is what's happened to home care and the increase in quality supply in licensed child care homes. The gold slices of each one of these pie charts reflects the number of new quality slots in Cook County and in southwestern Illinois that were in home care. As you can see, only 8% of all Cook County's new licensed slots, this is for children under, all children under 5, and in southwestern Illinois, only 1% were increased in homes, where it can be attributed to home child care. Okay. Then the last two bits of unfortunate news have to do with non-standard hour care. First, look at evening care. These bars, which you can see, there's different numbers at the top because they represent providers. There's different numbers of providers who are open here at 7 p.m. and later. The bars are even at the top because they're all 100% of those programs. Of all the programs that are open, you can see the blue, or I guess it's purple, or is it a blue, at the bottom represent the numbers of the percentages of those providers who are offering quality designated child care. Again, it's very, very low. There are slight improvements in Cook County from 3% to 6%, and in southwestern Illinois from 1% to 4%. But at the end of the process, not much has changed. And the same with early morning care. One of our research partners discovered that, looking at the census, that all families that most need non-standard hour care need non-standard hours care before before most programs open. So we looked at 6:30 in the morning. And again, this is just like the previous slide. These are the providers who are open before 6:30 a.m. And as you can see at the bottom, the darker segments of the bars represent the percentage of those providers who offer quality designated care. And again, very low. Some improvements, but very low. That's the research analysis. Maria Eslund, who is the Assistant Director of Public Policy.
Senior Policy Associate. Hi, everyone. This is Maria Eslund, Senior Policy Associate here at Action for Children. I'm just going to briefly talk about some of the policy implications coming from this research that we found. What policy levers do we have available that we could pursue to better improve access to affordable, high-quality care? Illinois should pursue policies that ensure families in high cost of care communities have access to affordable, quality care. We know that the price of child care, what parents are charged, or what the state, sets the reimbursement rate at, it's high, but it's not the same price, or it's not the same as what a true cost of delivering high quality care is. IDHS, the Department of Human Services, should set the child care assistance program reimbursement rates based on the actual cost of providing care within a specific community. And this would help to build the supply of affordable care and ensure that new and existing child care providers are actually able to provide those high quality services. Our policies also need to better support home child care providers and ensure that families have access to quality home-based care options. They're uniquely able to meet certain family needs, such as those working during non-standard hours, as David's slides just showed us. We've seen a decline in licensed home child care here in Illinois and nationwide, but we've done little to study or reverse that trend. Illinois first needs to better understand what's driving that decline in order to identify all the appropriate policy levers to reverse that trend. But we know it will certainly include, increased funding, more appropriate funding levels to allow for child care homes to invest in quality improvement and run sustainable businesses. Policies supporting an increase in the supply of child care homes will lead to greater access and choice for families across the state, particularly in rural communities. Along the same lines, we need to prioritize growing the supply of high quality care available during non-standard work hours. This requires investing in the quality of child care homes, as they are more likely to offer non-standard hour care. And Illinois should also consider revising the state's quality incentives, including providing quality subsidy add-ons on the front end rather than relying on providers to cover these upfront investments in quality and to wait for reimbursements later. And of course, ensuring the adequacy of the quality add-ons, making sure that the amount providers are receiving to improve their quality actually covers the cost of those investments. Illinois could also pursue new approaches, such as creating schedule incentives to encourage high-quality programs to offer extended hour child care. And this would also just require us to ensure that our licensing standards and all of our other governing standards provide that flexibility in their operating hours and support that type of increased flexibility. And the state should also prioritize the financial health of child care providers, especially in less financially stable communities. With this comparison of southwestern Illinois and Cook County during these years suggests that more stable providers were more able to respond to available policy incentives, such as those quality add-ons for CCAP in order to increase the quality. In more distressed communities where providers have less financial stability, investing in child care program stability, in addition to creating quality incentives, may be an effective way to increase quality. For example, longer-term contracts stabilize finances and provide more predictability over the years than annual grant cycles or certificate-based payments that are tied to individual children and their attendance. So that was a brief overview of some of the policies that that we can pursue to address the access issues that came to light through this research.
Our reports are available on our website, it's just given here, and there will be a follow-up email notice which will have a link to the reports. But if there are any questions now, please.
So think we can unmute the line. I think we can. We'll see if we can do it. But if you have questions, feel free to type them in the chat, the question of the chat box, or if we can unmute your audio, then feel free to just ask them on through audio. I will say, as we figure out how to unmute everybody, one of the areas that we're exploring in terms of policy changes is looking at how, as there's discussions around the revamping a state funding system for early childhood care and education, thinking about the implications from this report on what we can do to finance, not just how much funding we need, but how we distribute it, how we allow for providers